Hello, everyone. My name is Olivier Defawe. I'm a director of health system at VillageReach, and this is my pleasure to be joined by a couple speaker to talk about private sector engagement for COVAX, for which mean the preparation for the distribution of the COVID-19 vaccine in the next few months, hopefully. Couple housekeeping information at first. Your microphone has been muted, and we would like this seminar, this session, to be interactive. And so we encourage you to use the chat box to submit your questions. And after the recorded webinar, we will have 10 to 15 minutes to answer some of those questions. So please ask a question as it goes, as the webinar goes, and add them on the chat box. Without further ado, I would like to introduce you to Chris Larson, who is the Director of Humanitarian Logistics with UPS Healthcare, a division of UPS focused exclusively on healthcare and life science sectors. Chris has worked for more than 15 years supporting logistic, demand, and supply planning, as well as operation aspect of global public health programs for vaccination, HIV, malaria, and reproductive health. Chris, the floor is yours.
All right, thank you very much, Olivier. Appreciate the introduction, and thank you for an opportunity to address the TechNet Conference this year. We're honored to have the opportunity to talk to professionals in the vaccination industry and talk about the global pandemic, and certainly what we're doing in terms of preparing for the distribution of COVID vaccines globally. Next slide. What I'd like to touch on today is just a few different topics. To talk about what we're doing in terms of the supply chain. Kind of the best way to approach that is what we're doing on the end-to-end in terms of starting working with manufacturers, moving it through intermediate points, and moving the vaccines ultimately into low countries. Now, some of the slides we're going to look at here talk specifically about low and middle income countries in Africa, but this is a template for designing a supply chain solution that would work outside of Africa and other low and middle income countries. So what we'd like to talk about first is shipping the vaccines into country from manufacturer, kind of from the origin side, talk a little bit about what we've done in terms of modeling the storage requirements, the cold chain requirements within low and middle income countries, how we see that working, and how that matches up with the inbound supply, and then finally talking about some in-country last mile delivery solutions that we've been working on with various NGOs and other partners to try to make sure that there is some good repeatable solutions for distribution of these products once the COVID vaccines are available. Next slide. So when we look at the inbound flows coming from manufacturers, we've spent a lot of time working with manufacturers to understand where the distribution points are going to be, where they're going to be coming out of, what the handling requirements are for the various vaccines, to get a better understanding of them, as well as the temperature requirements. So as everyone's probably aware, a lot of these different vaccines that are in clinical trial stages 2 and 3 are different temperature ranges, right? Some of them are -80, a couple of them are -80, some of them are -20, and some of them are -2 to 8. And so it's a little bit of a logistical challenge at the moment to try to figure out exactly what we're going to have. But from our perspective and looking at this and working with manufacturers, it does seem like we're going to have to deal with some frozen vaccines, at least initially. Maybe not -80, but -20. And over time, as stability data becomes more available, then we may not have so many cold variations and may be able to stick to planning on the 2 to 8. But from our perspective, we want to make sure the capacity is there to get vaccines all over the globe, wherever they need to go to start vaccinating populations. And certainly we've been planning around some of these frozen formulations and looking specifically at different presentations, specifically a 2 ml single dose vial, and then also looking at 10 mil multiple dose vials to look at the different volumetrics and the different requirements for storing these. One of the lessons that we're seeing is that the tonnage is very large, right? The amount of vaccines to be shipped and to be maintained in the cold chain is large. You could see some of the numbers here in terms of the kilograms required at the 3% and the 20% population coverage models that we've been working on, and how this translates into actual flights and actual movements. Next slide, please. We could take a look at. Right. So one of the things that we're starting to realize is that the early vaccines are going to be moving not in large plane loads, but most likely in small amounts, small lots. And that's really going to be driven for two reasons. One is the COVAX mechanism itself is set up to around the equitable distribution concept. And so as vaccines are made available, they will need to be broken up, and as lots come out of the manufacturer's QA, they'll need to be broken up into smaller shipments that then go to a lot of different countries, right? With a constrained resource being the vaccine coming out of the manufacturer's facility, we see lots of small shipments going all over the place, at least for the near term, until manufacturers can get the scale and until larger amounts of it are available. So that's one. Second is, if you're looking at a frozen vaccine, -20, -80, you're still going to be shipping a lot of this product with dry ice, even if it's in reusable containers. But for the developing world, we think a lot of this will be in passive containers with dry ice to maintain the temperatures. And so we're limited there in terms of dangerous, dry ice is a dangerous good, and the amount of cargo that you can put on an aircraft. It's around 3,000, some between 3,000 and 4,000 kilo, depending on the aircraft type and things like that. But therein, a lot of dry ice is required. Sometimes, 60, 70% of the shippable weight of one of these shipments can be constituted in just a dry ice. So you're left with the 30, 40% remaining to be vaccines, packaging, any kind of ancillary materials that might be in there. Right. So that's the reality of it. And as a result, we think that there are going to be required to be thousands of flights, right? Thousands of flights, and many of them are charter or cargo only aircraft, but not filled up, right? So there's a challenge here to work on capacity in terms of the airline industry, and there's also a challenge to make sure we're looking at and making ready the type of containers and packaging materials that can be used to actually transport this material, right? So we see challenges potentially with enough dry ice. You've got phase change materials that can also be used, but they are newer technologies and a bit more limited in terms of the amounts available. So we think we're going to be looking at a combination of a lot of different packaging methodologies, and even the use of active containers that then have to be returned back. So a number of different things that we're looking at there, but we're thinking of, it's going to take 2,000, 3,000 flights to be able to serve these kinds of populations, even a 3% look at the populations across the African countries. Next slide. One of the things I'll touch on quickly is where the global air freight market is right now, and why this is kind of reflect on why we're concerned about it. At a high level, the overall market's down a third, right? But that doesn't necessarily tell the full story, especially moving freight into African countries, in particular in many low-income countries. And the belly-held cargo that's on the wide-body aircraft that are predominantly used for passenger traffic has been the main way of getting cargo into African countries over the years, right? For HIV, for malaria, for reproductive health programs and vaccination programs. That's been, the primary way of moving even these pharmaceutical cargo. The reality is those frames, the number of frames in service are way down by almost half. And the impact on that is more than 70% of the capacity, the belly cargo capacity that was in the market before is no longer there. Right. So that's a slight improvement from 82%. When you're down 82%, you almost have nothing going there. And we're at 70 now. and a lot of that falls onto cargo that capacity that would be able to take cargo into low-income countries and specifically countries in Africa. So we think the combination of the situation with the air market, where that is, in conjunction with the requirement to have lots of flights, at least in the first year or so, while more vaccines become available and some have a chance to get stability data to be able to be shipped at a warmer 2 to 8 degrees C. We're going to be struggling with capacity for moving product into African countries. So that's one of the areas that we're working on quite heavily right now. Next slide. So key strategies that we've been talking about, right, on this in this area. One is to start planning and working with air freight providers, right? And there's talk about convening some kind of a convening authority like IATA or other organizations that can work collectively to try to make sure we have enough air capacity in play. Not just cargo aircraft. Cargo aircraft are probably not going to be sufficient for this challenge. So somehow an arrangement needs to be made to bring additional aircraft in. And we see that there's potential for that with passenger airlines. Even though there's not passenger traffic, you can still use passenger airlines in situations for cargo. It's not something that's typically economically doable, but this situation may create a more or less perfect storm in terms of demand and economics to make that work, right? To make that, to be able to bring some of that capacity off the sidelines and make it work. We're also working at different kinds of supply chain solutions for an ocean option for 2 to 8, certainly with specialized containers is an area that we're looking at, and then aligning on packaging configurations, right? There's just not going to be enough packaging to go around. And so I think we have to be smart working with different NGOs and manufacturers and understanding the types of packaging that work best in different country environments and different situations, and coordinate on that so that we don't have situations where cargo can't be moved because we don't have the availability of cold chain packaging and containers. Next slide. So one of the other areas I said that we're working on is looking at within the African countries and within low and middle income countries, and what do you do with these frozen vaccines when you're going to bring them into the country, and what kind of capacity is there to hold them? So we've spent a lot of time working with on this now. Next slide, please. We have started down this path on the UPS side because we were adding a lot of freezer capacity within our global network, and the U.S. and Europe and other locations that we're looking at, and pre-buying a lot of freezers and freezer capacity to be able to be used to store these vaccines and handle these vaccines as they move. Now, anywhere from -80 to -20, again, we think the majority of the capacity should be focused around the -20 variation, but maybe some for the colder variations. Now, in looking at the frozen capacity, we are looking at a couple of different levels of freezer capacity. And if it's a -20, you're going to need some capacity at the central medical store to be able to bring the product into the country, be able to store it, and then prepare it to be moved around the country to points of administration. Kind of a second level would be smaller freezers that would be located around the country, kind of according to the network of that's going to be used for administration and where that's going to go. So regional or provincial or even local hospitals and things like that would need smaller freezers to be able to hold goods. So we've kind of built our model based on a couple of different levels of freezers. Next slide. And what this kind of looks like is looking at large freezer placement. There's a number of different ways that we can do this, but looking at it a couple different ways, we looked at the 2 ml vial and the single dose 2 ml vial and the 5-dose 10 ml vial. And from our discussions with manufacturers, we think Pfizer is using the 2 ml vial and maybe Moderna, but others are probably more along the lines of a multi-dose 10 ml vial. So when we're looking at this, freezer capacity and the numbers of freezers needed, it's certainly depends on that. Now, interestingly enough, a 2 ml vial is only about 2.2 times bigger volumetrically than a 10 ml vial. However, the 10 ml vial actually contains 5 times the number of doses. So that kind of math tells you that actually the larger 10 ml vial 10 ml 5-dose vial configuration actually takes significantly less freezer space overall, and requires fewer freezers in country as a result of that. So it's interesting how the numbers can kind of play out on this. But in looking at it, for a 3% population coverage, you're looking at probably 100 large freezers for the 10 ml doses, 160 or so for the 2 ml vial formulation. So you're talking about large amounts of large numbers of assets, large amounts of freezer capacity that needs to be added. Now, this is just kind of a raw analysis of understanding, how the vaccines will enter the country, right? And really understanding the freezer requirements. It's about a continuous flow, and it's a dynamic flow that's required within the country. You're not going to be bringing large amounts of vaccines in and holding them for long periods of time. Our view, as I said, is a lot of smaller shipments coming in. A lot of these presentations are going to be multi-dose, at least 2 doses. So you want to be able to turn your freezers on a regular basis in terms of fill them up, empty them out, and then refill them again. And you certainly want to look at time boxing the overall vaccination period. Like within 90 days, you want to cover your 3% of your population. Now, those numbers can be played with and certainly changed, but you want to be able to time box it and understand what the freezer capacity is in an environment where product flows in and flows out very quickly. And we think this is going to require a lot of coordination within the country, certainly in terms of getting the vaccines out to the points of administration and but it's going to be critical to being able to handle these vaccines as they come in, get them through the chain, and get them administered to patients within the handling lifespan of them. And like I say, many of them, after you thaw them out, have to be administered within a very short period of time, sometimes a couple of days. So it has to be very well coordinated in order to make this work. Next slide, please. So in terms of smaller freezers, same kind of a thing, same kind of a look. There's a lot more of those, obviously, that would need to be distributed. And really, to kind of work on this part of it, you have the mathematical model, but then you need to kind of work with a more detailed on-the-ground network model. And I know other NGOs are kind of looking at this, but it's critical the countries start thinking through this and not only prioritizing what parts of their population, but how they're going to be reached, where they are and how they're going to be reached, and what the administration actually looks like, because it needs to be a continuous flow within the country in terms of turning it and getting it out to the sites. Okay, that's good. Next slide. So last, we want to talk about some of the in-country last mile delivery solutions, right? So we're looking at, what have we got to move it into the country? What have we got when we're storing it there? What about moving it around within the country? And, looking at refrigerated trucks, investments in those areas, and certainly cold chain packaging I mentioned earlier, and even drone delivery, we think has an interesting part or a significant part to play here. Next slide. In terms of refrigerated trucks, right, just to kind of show you an example here of a well-planned out distribution network, Gavi and UPS and our partner in Africa, FIT, one of our partners in Africa, and among other donors were involved in this. And it's basically putting together an on-the-ground distribution network, an outsourced distribution network run by a 3PL, and it covers 3 different provinces within Uganda, but it's a good, successful project in terms of effective distribution. And what it's done is to put one cold chain capacity out there where it didn't fully exist before in terms of refrigerated trucks, but then also putting in place a regular and rigorous delivery schedule, right? And so that every clinic knows they're going to be visited by this delivery schedule and when they're going to be visited. We've wrapped around it some basic IT applications that give visibility to inventory, visibility to orders, and visibility of shipments that are in transit. And so without a lot of investment in heavy IT, there's an example of a delivery network that works very well. And this has been reviewed by Clinton Foundation as a third party to evaluate the effectiveness of the network. And there was significant reductions in stockouts, and product availability was much higher. So there was a lot of positive feedback across the chain, indicating that, hey, this is a direction that we probably need to go, and looking at extending this out with the use of drones. So this is able to cover, you're able to hit a lot of areas with trucks and motorbikes. As part of a solution like this, you've got some good cold chain handling packaging that you're able to use for this. One of the areas we think is relevant to not only general vaccines, but especially COVID vaccines, is drone delivery to reach these hard to reach areas. Keep in mind, vaccine campaigns are usually only vaccinating small parts of the population, and indeed we're modeling on small parts of the population. But longer term, not even longer term, right? As soon as possible, countries are quite anxious to start vaccinating large parts of their population. So these remote villages are not only going to need a few vaccinations for the children that are born in there, they're going to need vaccinations for everybody. So or nearly so. And this is a very different challenge. This is a very different situation, and so we think a number of different assets and approaches are warranted on the ground in terms of delivery. Next slide. So I mentioned packaging. This is just an example. This is the softbox. This is not a UPS product. This is just an example of things to look at. Right, so there are these kinds of disposable packaging that can be loaded up with dry ice that can maintain temperatures for a significant period of time, meaning 4 or 5 days, even at a -80. Right, so -20 can be managed in this way as well, but we need to kind of start planning this out, right? And the devil's in the details in all of this, right? So when we're doing the distributions, and what's the cold chain requirement at the location where you're loading the vehicles? What's the mechanism for handling these frozen vaccines in the vehicles out to the different areas, right? That's where the packaging necessarily comes in. And some of the remote areas may also need to have this packaging that's good for a few days, and that can tie in quite well with supporting their administration plans as well. So packaging is another super important and key element to this. And lastly, drones. So we've been working with a number of partners on drone delivery, and have been looking at piloting these for a number of different public health and programs. Vaccination programs have been a key focus of this as well, but now COVID comes along and presents, as I mentioned a minute ago, a very different challenge and a very different scale to a vaccination program. And so we think that there's a lot of ways of being able to use drones, and we're exploring a lot of those. And we think that in working with the countries to set up a few drone projects that are reaching some of these remote areas with the ability to handle the cold chain vaccines is key to getting us into a position where by the middle of next year or earlier, we can start going to scale with some of these kind of local delivery capabilities, including drone deliveries. Next slide. So we think the important part of drone delivery is to integrate it, not just run it as a separate network, but integrate it into distribution networks and use it as an ability to extend a network that is otherwise constituted by trucks and motorbikes and other means of transportation. Right, so basically the concept is you hit where you can by traditional methods, and you hit the additional places that are harder to reach and can be reached economically via drone. Remote ordering can come into it. The packaging configuration you see there in the one picture, right? It's about creating this envelope or this package that's able to maintain temperature, and what are you going to put in that? How is it going to be configured ultimately to get it to the location it needs to be administered as a shot and as a vaccination shot to a patient. So we think this is a good time to be looking at drones and what they can do to supplement the delivery capacity which, as I mentioned, it's a much bigger chore than what it's ever been in terms of vaccination campaigns to reach this number of people, and the understanding that the current methods and assets are probably not going to be sufficient for that task. And with that, I'll turn it back over to Olivier.
Thank you so much, Chris. Very interesting presentation. Really highlighting the logistical challenges that we're all going to be facing to move such a large volume of products, trying to reach the world, the entire world population gradually. All the packaging issue, the cold chain equipment requirements is just it's just mind blowing, and it's great to see that UPS is thinking ahead and part of the community that is planning this COVAX. And really, I see the COVAX being really an opportunity to really start thinking about innovative solution, innovative network designs, processes, technology, like you just finished with the drone, and hopefully this pandemic is an enabler, an accelerator to really start thinking out of the box and rethinking the supply chain globally, regionally, and local. And for that, to continue this discussion, I have the pleasure to introduce you to our next panelist, Maeve Magner. Maeve Magner is a well-recognized global health supply chain and market access expert. She's a trusted advisor to donors, government, and a lot of businesses, and she's really passionate about in-country organizational and market capacity, scaling, and sustaining innovation for impact. So welcome, Maeve.
Thank you, Olivier. It's great to be here, and good to be here with Chris as well, and hear about all the fantastic work that you're doing.
Nice.
So for the second part of this session, I would like to ask you, Maeve, and Chris, feel free to jump in at any time. A few questions. The first one is, and what Chris just presented illustrates very well that one of the biggest lessons from this pandemic is the danger to depend heavily on the global supply chain. So Maeve, I'd like you to share with us your thoughts about how do you see the future of logistics, where maybe regional and local private sector would play a role, and what it would take to make that shift happen?
And thanks, Olivier. I mean, that's a very important question. And I think when I look at the pandemic at the moment, it's critically important that we have the global, regional, and in-country, and even with in-country, national and subnational supply chains. And it's critical that all of these organizations and systems work together. However, I want to focus my answer more on the future and dealing both with the pandemic in the short term and medium term, but also in the longer term time frame, which I think is even more important. So as I look at the transition that many countries, low middle income countries, are going through from donor funding to domestic funding, as we also see the increase in disease burden, which also means an increase in the amount of stock that is actually going through these pipelines. It's very, very important that the national and subnational capacity for both storage and transportation is built is both increased in terms of the quality, but also in terms of the quantity. And I see, I've been in global development now for about 11 or 12 years, and I have seen a lot of investment by donors into structures within the public health systems. So we'll see many of the central medical stores that have been retrofitted, or new medical stores that have been built. We've also seen a lot of transportation, new trucks, different sizes, and even, as Chris talked about, new methods of transportation, including drones that are being adopted. However, I think that we still have a long way to go. And I think that it will be really, really important that we take some of these markets, which are actually very fragmented at the moment. So when you go into many of these countries, as you'll know from your time in DRC and other countries, you will see that there are a lot of individual actors that have their own trucks, and they will have certain areas that they will support in that. While at a national level, you'll see some of the international and some of the national players, but they don't necessarily have the full geographic coverage within the country. And what you will see is that if organizations like UPS or DHL do delivery within those countries, it's usually through agents, and sometimes even these contracts are subcontracted 2 or 3 times to ensure that it gets to the more remote and rural areas. And over time that's improving, but we still have a long way to go. So for me, I think it's very critical, both for the local economies, but also for the long-term sustainability, for public health, for private health, but also as well for other industries, that the work that has been started continues, but actually in actual fact, using a word that you used earlier, actually accelerates even more, because the urgency is getting, it's becoming more urgent when we are seeing these pandemics, and also when we're seeing a lot of these natural disasters that are now happening on a more frequent basis. So it is important that the burden is actually being moved from the global and more to the local area. In terms of how we do that, I think we've, again, like I said, we've started that within the global development space. And I actually want to refer back to an example that you give, Chris, and one which I had been involved in at the beginning as well, is this partnership between UPS and FIT. So again, you work with agents, and having like multinational organizations like UPS working with local agents and helping them to build a capacity is very, very important. Because what that does is that highlights the levels of standards that are required to support international organizations or international clients, and therefore you're bringing those standards into many of these low middle income countries. But I would even go further to say, in the public health side of it, the partnership that Gavi, UPS, and FIT had is a prime example of taking that relationship between UPS and FIT and extending it down into the geographical areas that are underserved and that require the transportation and the storage infrastructure and facilities that are needed to ensure everybody is getting the vaccines, or they are getting the access to the quality, affordable medicines. But I would say one of the challenges that we are seeing in this is that there is a lot of support for proof of concepts, and there's a lot of support for pilots, and there is engagement with the governments. But where we're struggling is that we highlight and we bring all the right parties together and we highlight the benefits of these types of partnerships. But when we try to scale that, there is a huge challenge, and it typically tends to be around who's actually going to pay for that service, or who's going to, to continue to fund the work to scale it up. And I feel that we still haven't cracked the nut on that, and I think that there is opportunity there. And I say that in that this isn't always for the Gavies or the global funds or the Gates Foundations of the world to have to write the check, but I feel that we haven't yet found, where that needs to be, what those sustainable business models are, and how best we can engage the different private sector actors and government actors and that. And I guess the last point before I give Chris and yourself a chance to comment is I also see we're seeing a lot more innovation being adopted. Again, Chris talked about the drones, and even with that FIT and UPS and Gavi project in Uganda, we saw the use of smart temperature monitors. We see like a lot of innovation that's being adopted in the supply chain area, and I think it's a credit to the donors and the governments and the private sector organizations and the startups to actually embrace this and move forward. But again, we are seeing challenges with many of these startups in terms of scaling and sustaining. Again, they're receiving funding from donors that will help to do the proof of concept, but we're struggling to attract in the right type of VC investors or private equity. We're also seeing that the cost of capital for many of these organizations, the growth capital or even working capital, is actually very, very expensive. So we almost have this part of the ecosystem to where we have a lot of focus and attention on innovation and doing this proof of concepts, very early stage innovation. And we have this big focus on, the big tickets. So if you want $100 million, it's probably not that difficult to go get that from IFC or World Bank and so on. But like if it comes to like the, anywhere between 2 million and 10 million or 2 million and 15 million, and we're very challenged in terms of being able to make that available for many of these startup organizations. And it's not just about finance only. There is a lot of capacity development that is still required. But let me stop there because I've said a lot and I want to kind of make sure that some of this lands, and just wanted to see if Chris had any kind of comments that he wanted to make on that as well.
Well, I would totally agree with what you said, Maeve. There is a lot of opportunity for innovation. The technology has advanced to the point where there's some really good opportunities to figure out now how to apply it. And with drones, it's not a question of can you deliver product with drones. The question is more, can we create a targeted solution that's cost effective and is able to deliver cold chain vaccines, right? So that's kind of a specific challenge there. And the first part is trying to what does an economical drone delivery arrangement look like, right? And part of the challenge of getting this to a more of a mainstream solution is having a better understanding on the ongoing cost structure of it, right? And to understand, in the market, if you go out and you want transportation, you want trucking or something like that, it's easy to get a price for it, right? What's a fair price for delivery for drone delivery, right? And no one really has facts, right? No one really knows. So one of the things that we want to try to figure out is that around the cost structure, what should it be, but also again, not just simply the delivery of the drones, but the innovation of being able to create a repeatable model that can handle vaccination campaigns in different areas. What does the launch site need to look like for that? What kind of GMP compliant handling capability needs to be there. Cold chain capability needs to be bundled in with that to handle vaccines. So there's some technical questions around that we would also like to see kind of bear fruit and be answered more directly through the opportunity to test these out in pilots and things like that.
Thank you both, Maeve and Chris. This is really exciting. I just want, on the topic of the difficulty to scale and sustain innovative solutions such as drone, and I'm taking this example on drone. There will be later this month or early November, the UAV for payload delivery working group will be organizing a roundtable discussion, bringing together financial experts from VC, private investment to exactly talk about, okay, what are the financial mechanism that can enable those solutions that has shown impact at smaller scale through those pilot implementation. How can they transition to more sustainable and scalable activity? I want to take this opportunity to ask another question around, we've talked a lot about, so this is, the topic here is private sector for COVAX. And we mainly talked about transportation. Maeve, can you explain, or what's your thought about what else can we leverage from the private sector to help prepare and to help assure the delivery and the accessibility, equitable access of the future COVID-19 vaccine? This has got to be more than just for transport. The private sector has other role, like you two could play other roles. Could you share your vision about that?
Yeah, that's an easy question, but a difficult question because you have so many, the private sector can mean so many different things. I do think, and this isn't an area I normally think about, but I actually do think that given the huge, if you look at the numbers that Chris had, he's only talking about 3% of the population or 20% of the population. I mean, the costs to actually transport these products from, manufacturer right down to the last mile is going to be so expensive, really, really expensive. And I'm not sure how the funding is coming through at this stage in COVAX to cover all of the transportation to the very end. But I mean, I do think that the private sector organizations, corporations in many of these low middle income countries, and quite frankly, some of these global organizations that have a presence there, I hope will feel that they have some part to play. And I think the financial side of that is very important because you don't necessarily want competing activities going on. I mean, if there is a global effort to get the vaccines in and to coordinate the transportation and the storage and all of that, then I think that, they should be aligning with that. But I think more practically, as we talk about cold chain, ultra cold chain, as we talk about, the storage, and I think the storage is going to have to be regional, national, and subnational. And I think we have to think about the energy requirements. And I can see that, in many countries where there are challenges around, reliable energy, we are going to have to be looking at, generators, or I assume many of these are not going to be solar fridges and that. So we will have to think about the energy part of that. I think also we have to look at the maintenance, and we have to also look at and again, I'm still thinking about it in terms of storage and transportation and the infrastructure along the lines, but I do think that there are parts of that that we really do need to look at. And I'm just wondering as well, we talk about the central medical stores, but there's probably opportunities with several 3PLs to actually leverage their facilities as well, or even some large corporations that may have big facilities in some of these regions, we may be able to leverage that as well. So again, you would think about, beverage companies like, Coca-Cola, and that may have access to facilities or to resources to support those facilities that could be leveraged. But I think that when we think about the private sector, I think the transparency visibility is going to be extremely important. I think part of that is going to be the traceability of the products and where they are. Part of that also is going to be around the temperature monitoring. And I know Gavi, another one of Gavi's partner is Parcel, who've got these smart thermometers. And one of the things that they're working on with the insurance industry is around using data to actually, as a risk management tool, but also to come up with a viable insurance product, which I think is very innovative and is also it's not how we would traditionally think about the private sector being involved. So now we're talking about the insurance industry being involved. I also think as well, we have also been exploring control towers. And I think that leveraging control towers to actually be able to give visibility, I think is very important. But then also, as we do look at pulling data from multiple different sources, and if you're thinking now about all of this data that's coming from the transportation side, the storage side, but also from the different central medical stores, coming from the manufacturers and so on and so forth. I think there's also going to be a need to kind of pull all of this data together. And one of the challenges that we have with data is around this aggregation of data, the cleansing of data. So I do think that there are private sector organizations that can help us to think through that. And then also as well, thinking about along the same lines of that is as we're pulling data from the campaigns, understanding how much stock has gone out, what has been used, understanding the wastage and all of that. I think that will be important. And again, an area I've touched on briefly, but we haven't talked much about either, is wastage and the reverse logistics. So not just in terms of products expiring, but really also as well, what all those vials and packaging going out there, how do we actually bring that back in again? And what do we do with that, right? So, I mean, there's a whole industry around waste and we don't think about that, right? And especially in many of these low middle income countries, all that stuff is going to come back. So where's it going to end up? So I think we have to kind of lean on the private sector, and especially across some of these other industries as well that can probably help. And finally, one of the interesting conversations I've been having recently is the engagement with the agriculture sector, and especially around vaccines and the use of dry ice and all of that, because in actual fact, the agricultural industry use vaccines for the animals, and also use dry ice and all of that for the movement of semen for AI for animals. And we don't tend to tap into that. So there's probably private sector organizations within the agri-industry that we could probably connect with and leverage their expertise as well. But we do tend to kind of stay within our sector. And I do feel that this is an opportunity for us to kind of move outside that sector a little bit.
Thank you. And in the 1 minute that we have left before we bring the question from the audience, you mentioned agriculture sector. We could tap on that. What about the humanitarian sector? What about leveraging, for example, all the asset and the logistical expertise that, for example, a group like the World Food Program they have warehouses, they have fleets, or there are also logistic experts. So beside the private sector, can we also leverage those agencies that has really assets and expertise throughout the globe?
Yeah, absolutely. So, I mean, I think in the pandemic situation, we should be doing that, and there's no excuse not to. And I think if you take World Food Program, if you take UNICEF, UNFPA, like a UNDP, I mean, they all have access to tremendous network. You know, and I'm going to be very bold in what I say, but I just think that they need to learn how to work together. And figure out in country, and this is also as well, like private sector, UN agencies, government agencies, we all need to just learn how to work together. This is actually about ultimately getting the vaccines to the people that need them. It's about getting the PPE to the people that need them. It's about getting the diagnostics to the people that need them, the medicines, and we just need to leverage the networks that are out there and work together to make that, to increase that access. So yes, Olivier, to answer your question.
I think the summary is like collaboration among all stakeholder and sectors is the key ingredient during this global health crisis. Thank you so much, Chris. Thank you so much, Maeve. We now are going to be switching to Q&A. So we're going to be looking at the question that's coming out, and we're going to go to a live session. So thank you very much. This ends this recording.
Thank you, Olivier.
Bye-bye.
Thank you.
Thank you, Chris.